AstraZeneca, you ran out of stock in terms of that. And now you are, you turn to this Sinopharm. But you have a portion of the population who really don't trust that vaccine. And you talk to people to tell them to go and take this vaccine. They tell you, no, I don't trust that vaccine. What are you going to do about that?
Oh, that's funny because, when we had the Sinopharm, I had top officials, top scientists, top people working in who came and said they are not going to take any other vaccine except we give them the Sinopharm. That time, the Sinopharm was not licensed because people do their research and they saw that this vaccine was tested in Brazil, tested in other places, and the results were very good. That time, we were given the AstraZeneca, and some said, no, I'm not taking the AstraZeneca. We said, no, sorry, but it's not yet licensed. We cannot give it until it's licensed. Although some countries have licensed it, but WHO has not licensed it, our country has not licensed that time. So there are many people who were actually waiting for the Sinopharm. So there are also some people who may not prefer it, and so they have other options. That's why the country is not only bringing one vaccine. We are bringing 3 to 4 types of vaccines. But as a government, for us, they are all the same to us because they've all gone through the process. The efficacy has been ascertained. Safety has been ascertained. That's what we are interested. So we don't want, to us, it's the same. Whether you take AstraZeneca, Johnson & Johnson, just sometimes the logistics. Some of us prefer the Johnson & Johnson because it's logistics. It's easy. You just give it one. You go to their place, give it to them, and they get it. So we prefer it, but not because of it's more efficacious or it's better or anything.
Let me also ask you, because you brought back the face mask mandate. Now you are saying people must wear a face mask or be fined $1,000. But if you look at the enforcement part, since this announcement came last week to now, I have been going out, and really compliance isn't there. People are not really wearing face masks, and they are working fine. Nothing is happening to them. Almost all public places. What are you doing about that?
So we are working with the police. So it will be difficult to take everybody to court and all. But I know one thing they are doing is if they see you, they stop you until you make sure you buy a mask and all that before they allow you to leave. If you're in a vehicle, you get down and you are delayed for all the time. And I think very people who are very recalcitrant, maybe they will prosecute those ones. But at least they are doing something about it. And on Saturday when I went around, I was a little happy because I saw that the drivers were putting it on. And I think tomorrow they will be maybe more vigorous about it, I suspect.
How about the issue of the Tobaski? Really, tomorrow is Tobaski. And you will have a lot of people who will go to public places. People are going to form large gatherings and what you call super spreaders. What are you going to do about that?
So tomorrow we are urging people not to go to distant places. Like if you live, I'm from Charmin village, so I don't have to really go this time to Charmin. Let me just stay here as much as possible. And if you must go, if you go, make sure you take your own mat, you observe social distancing, and you wear your mask. And the movement, this Salibo, we are not encouraging it, because if somebody has it, then he'll be going around and spreading it, and it's a problem. And we are hoping that tomorrow it rains heavily, inshallah.
That's so that people
can impede also the traffic.
So that people don't go out. But also, let me go back to the issue of the vaccine, because I have had people who took the vaccine, yet they tested positive for COVID. One example is Sajid of the British Health Secretary. He tested positive and he took the vaccine. So as an expert, are vaccines really safe? Can it protect you from COVID?
Yeah, so the vaccines, there are different ways they assess them. So if you look at, for example, one of them, Sinopharm, if they say, does it protect you from having the infection? It's not very high, maybe it's about 55 or so. So, but does it prevent you from having severe disease? So it goes to 79 or so. But if you look at one of the studies for Sinopharm, does it stop you from hospitalization? It's 100%. So these vaccines, they have good reason. They are very important because they stop people from the most important thing, which is dying. They stop severe disease, they stop hospitalization in a very significant amount. But sometimes they don't stop you from having the disease at all. So because you may have it, you may have the infection, but you will not have the severe form. So if you have the infection, you might still spread it, but you will not have the severe form. So if all of us have the vaccines and we will not have the severe form, it reduces the main problem is that if you have the severe form, you take the hospital beds, people cannot go to hospital, and you yourself might die. And taking care of one person in an ICU is very costly. You see these people are talking about renting in a hotel. It's expensive. One night in an ICU can pay maybe 10 days in a hotel or 20 days. It's very expensive.
Let me also ask you the issue of people being oblivious to the fact that COVID exists, to the reality that COVID exists. You talk to a lot of people out there and they say, hey, look, because I've been monitoring people's reaction when you said that we are in the third wave and this press release of the face mask mandate. People are saying, okay, this is a broke government. Now they need money. They want to do this so that they can get money from the Europeans. What are you doing? Because there are a lot of people out there who really do not believe that COVID exists. You talk to them COVID, they said, What are you doing to changing that mindset?
Yeah. So that shows we have a lot more work to do. Maybe our strategies, we need to improve on them, maybe to get those people on board. Sometimes maybe we are using just didactic measures or engagement in the communities. We need to use more maybe role models, young footballers and all that to go also and talk, depending on who communicates with them so that they understand. And sometimes also we go further to talk to the people who owns these platforms, like Fatu Network. You're allowing somebody to come here and spew certain things. It's not, we discuss with you and all the media so that they don't give platform to those type of people. Because according to the law, it's not even right. If somebody comes here to say certain things, you have to ask them to prove it. And most of the time they can't prove it. And then the public will be able to judge for themselves why they are saying such things which are not right. So this conspiracy theories that is going around, the best way to approach it is to counter it with knowledge and to bring out good evidence to show them that this is what is happening. So that the other people, those people may not believe it because they are already have head on that they will never accept, but the others around will not follow them.
So let me ask you this very important question then. COVID, everybody is talking about COVID. Doctor, as an expert, as a health practitioner, what is COVID-19 and what happens to someone who is infected with the disease?
Yeah, so we have different types of germs that can cause infection. So there are different categories. You have some they are called protozoa. Protozoa like malaria and others. You have some that are bacteria, they are a little smaller than protozoa. Then you have viruses. So this is a type of virus. So the viruses also, they have different types. Well, this is a type of virus that causes, that enters your cell. Because human beings are made of small blocks, just like this bricks we have to make houses. So many of them, trillions, made us human beings. So these viruses, when they enter those cells, they cause them to stop or to cause inflammation and all that. So especially around the lungs. And then you start to have this different manifestation of symptoms. Sometimes it is the immune response towards that causes the symptoms that you see, like the fever and wanting to remove it, like coughing and other things. But this killing of these cells could lead to problems to the person.
But what are COVID symptoms? What are COVID symptoms? What happens to someone who is infected with COVID?
Yes, so it depends on where it affects. You can have, your body can be warm because of there are some cells that are there trying to say that they will eliminate this virus or the infected cells, and all that. So you can have fever. Some of these people can have coughing because it affects the respiratory tract and irritates it. And because of that, you have coughing. Then some will have sweating, joint pains because it affects the muscles, malaise, and then some will have respiratory failure even. Like they don't have enough oxygen in their body, and so they need to be helped and all that. And then if you don't have enough oxygen, that can cause more problems also. Like because of the lack of oxygen alone, your body respond to other methods, and then it can cause you problem. Like you can have hypoxemia, that is like your blood cells are not having enough oxygen, and then because of that, anaerobic respiration starts. You have lactic acidosis, and many other problems come. So it could go up to the level where you can have respiratory failure, and then you may succumb.
And if you look at the amount of people that died out of this virus since it hit the country, about 160, and great majority of these are older people. Why is older people dying more than the younger ones?
Yeah, I think it's because of the immunity. That's what I think. Because it's very old, because this is very elderly people, their immunity might be low and they will succumb. People with diabetes also are more prone to having severe disease and also dying. And people with respiratory disease like COPD and others are also more prone to. Yeah, so it's not only the elderly, but those with comorbidities also. Like if somebody has another sickness, like diabetes especially. In Gambia, we've seen that diabetes constituted a big number of the people who had mortalities.
Doc, before we go, I want to you to speak a little bit in Mandinka and Wolof, because I think this is important. You have a lot of people that are interested in something like this, and maybe they might not really want you to say it in English, of course. So, Doctor, let's start. You are fluent in both. You are good.
I'm fluent in Wolof.
In Wolof. Doctor, mbiri COVID bi, because gis nañ ne issue ngeen statement ne COVID second third wave bi ñëw na te bi dafa xaw a doy waar. Mën nga ñu wax situation bi in terms of COVID naka la mel si dëkk bi COVID maanaam coronavirus.
yow fu mu toll nii moom mbas mi dafa garaaw dafa jéggi dayoo parce que lu xewoon mooy fu mu toll woon la bu njëkk a njëlbeen at bu passé ne le soo ko xaymee comme suñ ko xaymee fu mu toll nii dafa doon ñeenti yoon ba juróom-benni yoon am su la toll te eggaaguñ si fu nga xam ne foofu la gën a kawee te su eggee foofu mun naa am suñ continuer nuñ doon def suñu eggee foofu dina garaaw torop so loolu tax ñu gaa ñëpp a ngi jóg di si wax di si jël ay jéego te ñun ñëpp a si war a taxaw ku nekk sooy génn nga sol masque ba pare ñu moytu di bu jege wante nit yi su ñoo dem julli ñu make sure ne ñu ngi mayante 1 meter loolu moo ñoo mën a dimbale pour nga xam ne incha allah ba pare nit yi tamit dem jël seen péngo yi suñu péngo bi jotee Gambia gis ngeen last time dañu am 51,000 doses daf ñu jël long time balaa moo jeex loolu daf ñu war a jël 1 week nit yi yëpp war a ñëw quick la ñu jeexal ko waaye ñëpp di jël time loolu dafa tax next batch bi sax da ngaa ragal ko ici parce que soo ko ici mën naa expire so ñun ñëpp suñ ko ñëwee dañoo gaaw jël ko den ñu mun a am suñu vaccine yi as soon as possible mu mun ñoo fanq si feebar bi fu mu tellu nii dafa gën a am doole last year bu ñu gisoon mooy nit yi ñu ngi doon feebar waaye ñu daan am feebar bu métti bi bariwutoon waaye bii yoon ñuy am feebar bu métti bi dafa bari torop soo gisee téeméer bu nekk ñu ko nekk di am dafa bari compared to bu njëlbeen bi woon so loolu tax bii ñun ñëpp ñu bugg a jóg fagarlu bokk si xeex bi incha allah.
léegi naka mbiri face mask bi parce que gis nañ ne léegi yéen ngi wax ne nit ñi dañu war a takk face mask wala ñu fay $1,000 loolu naka la fa demee. waaw
loolu luwaa la képp ku ko toppul rek dinañ la di nga jotee luwaa bi waaye not only luwaa bi dañ ko def pour mu aar ñu ndaxte feebar bi loolu benn si lu ko fanxaala su dul loolu su continuer di am doole lu ñoo def mooy gën a ëppa dañoo tëj dëkk bi ay yooyu te loolu ñun ñëpp suñ jëlee ay jéego mais duñ egga foofu because tëj dëkk bi dafa métti kenn du mun a génn doo dem liggéeyi and all that so loolu tax ñun dañ naa ñëpp sol seen masque yi sooy dugga si banque nga sol masque sooy dem si taxi nga sol masque soo ko solutee moto police yi neen la fekka ñu wàccee la ba nga am masque mais bi nga solaat ko oo ñu yóbbu la nga fay xaalis $1,000.
Doctor, jërëjëf ni nga ñëwee fii kontaan nañ trop. Thank you very much, Doctor.
Thank you very much.
So that will bring us to the end of today's show. Thank you for being there. So tomorrow is Tobaski. So on behalf of myself and the Father Network team, we wish you a very blessed Eid al-Adha in advance. Thank you really for your support. We appreciate everything. And by the way, the president initially declared that there would be 1 day public holiday. Today, there has been an adjustment to that. Now it will be 2 days, Tuesday and Wednesday. Thank you very much. We'll see you on